So we have some good news in Oklahoma. It appears that voters, via a ballot initiative, have actually voted to expand Medicaid to the state's residents. Now, this happened again during a night of primaries with some mixed results. For example, John Hickenlooper defeated progressive Andrew Romanoff by a fairly large margin. Hickenlooper, I mean, that's the guy who drank fracking fluid. And he also said, I really wouldn't make a good senator. Well, yeah, apparently. And yet you still got, convinced into running for this seat. So now you got to take on Cory Gardner. So now not only do you have Hickenlooper winning, but you also have, of course, Amy McGrath beating Charles Booker by a very razor-thin margin. And so that sucks. Amy McGrath, of course, is supposed to take on Mitch McConnell. And basically, the people of Kentucky have just made sure that Mitch McConnell is going to win another 4 years. Anyway, that said, shouldn't focus on the negatives because there's a great positive here because it's a big win for the people of Oklahoma. So let me go to how the vote went. With all precincts reporting on Tuesday, State Question 802, which asked voters to expand Medicaid, passed by 6,488 votes. And so, as you're going to see, this is a situation where it is rural versus urban. Now, there's a slim majority, right? But the voters not only expanded Medicaid, but also enshrined it in Oklahoma state constitution. That means the people who voted for this were very, very clear in their message. This is the will of the people, and you're not going to touch it. You're not going to get to mess with it. You can't do anything. Passing it in this way prevents Oklahoma's GOP-controlled legislature and Republican governor from limiting or undoing this expansion. So it is there to stay. It is there to stay. Now, I have a quote here from Yes on 802 campaign manager Amber England, who said this, quote, "In the middle of a pandemic, Oklahomans stepped in and delivered life-saving care for nearly 200,000 of our neighbors, took action to keep our rural hospitals open, and brought our tax dollars home to protect jobs and boost our local economy." So I love how they got this done. It was people-led, not politician-led, which is the way all movements should be. According to the Oklahoman, the campaign for SQ 802 was launched after years of legislative inaction on the Medicaid expansion. Republicans, of course, didn't want to expand Medicaid. In fact, you still have people in Oklahoma, the mostly Republican-controlled, again, legislature and governor, that are saying, oh, great, now we have to expand health care to people, and we can't afford to do it. I mean, we're going to have to cut other things. But I'll get to that in a minute. Now, the Yes on 802 campaign turned in a record number of signatures to qualify this question for the ballot. And again, these were people mainly in urban areas. In rural areas, they generally tended to reject it. 70 of the state's 77 counties, mostly rural, actually rejected the proposal. This led John Tidwell, State Director of Americans for Prosperity and chairman of the Vote No on 802 Association, to say this, to basically point out that there was no widespread support, which, again, is a ridiculous talking point. Let me get to his quote. "Results are clear. A plan that claims to save rural health care was overwhelmingly rejected by rural communities across Oklahoma. Voters in more than 90% of Oklahoma counties voted against SQ 802. Well, that's because there's like 5 people living in those counties. Okay, a little bit of an exaggeration, but you have most of the voters that are concentrated in city areas. That's where most of the people live. And most of the people said, yes, let's do Medicaid for the poorest Oklahomans. This is not a difficult question. Yes, we would like them to have health care. And as far as rural voters are concerned, why did they turn against this? It's because I believe, and maybe I'm wrong, but they're convinced to vote against their own self-interest by people like Tidwell and the Republican Party and all the corporate-funded news. They want to give tax cuts to corporations and the wealthy instead of providing health care to their constituents. Governor Kevin Stitt also said that expanding Medicaid is not practical. Oh, it costs the state too much money. It's funny because a lot of other states, I believe 36 seem to have been able to expand Medicaid without too much of a problem. Weird. But he said, quote, you either pay for it by reducing roads and bridge funding, education funding, and public safety funding, or you raise taxes. And as your governor, I'm not raising taxes. Oh, okay. So basically screw every one of these other programs to fund Medicaid to get people to, of course, resent voting in favor of Medicaid. And that's what that situation is. That's exactly what he's doing, saying, hey, man, look, I'm going to have to defund these other things. But in reality, he actually had the choice to not do either. Earlier this year, Stitt vetoed the funding mechanism for his plan to expand Medicaid. The funding did not necessitate a tax increase or any cuts to state agencies. So he could have done this without doing any of that and still gave 200,000 Oklahomans Medicaid. But he decided, no, I'm not going to do that. I'm not interested. I don't want people in my state to get health care, to get health insurance through the government. I don't believe in that at all. And that's gross. At their core, Republicans do not want poor people to get health insurance. So he's an absolute gross person and a liar, because he lied about this entire thing as well. I mean, they'd rather people go with no insurance than go through the state. Now, of course, if you don't have insurance, that actually makes health outcomes worse. And when people, and this really does affect Medicare and Social Security later on in life, because if you go through your life without insurance and you develop these chronic conditions because you can't get them treated before they become disastrously expensive chronic conditions, then you're costing the system actually more money in the long run. But then again, that benefits Republicans as well, because they want to shut down Medicare and they want to shut down Social Security. So really, it's a pretty well thought out plan to not only deny people health care throughout most of their lives, but also rip it away from seniors. And so, like I said before, gross people, absolutely the worst. So now there's more here. Amber England has got a quote. She tells the paper, quote, I think the governor doesn't have a very good memory. He just had an agreement with the Hospital Association and the legislature to fund it this year without raising taxes. What's wasteful is leaving $1 billion on the table every single year that we could have been bringing home to invest in our communities and providing health care to our folks, which, of course, is the very people who need this the most. So I want to give you another quote here from one of the voters, one of the people who actually said yes to it, that I had a little bit of a problem with. Now, this is Edmond voter Christine McIntyre. She said that she voted for SQ 802 because of her son's difficulties in getting health care. Well, that's great. This is what Medicaid is for, right? To help people who are poor, who are struggling to get health care. She said, I have mixed feelings about it, though. Part of me would vote no, but I have an adult son that makes borderline poverty that doesn't qualify for Medicaid, and he doesn't have health insurance. Because he doesn't have health insurance, it affects his family and upsets me. So I voted for it, even though personally, I probably wouldn't have. I don't know how I would say no. Well, look, she did the right thing, obviously, and you can tell that she's being pretty honest about it because she has a mixed feeling. But I think this is indicative, I think, of the average Republican voter, the kind of people that don't like government programs until it affects them personally and they need those programs. In this case, it's her son that needs it. That's a family member who has their own family and they're suffering and they need health care. And I get it. Nobody wants their families to suffer. Of course. The thing is, I don't just care about my family. I care about everybody's family. I care about your family. I'm one of those people who are willing to fight for a person that I don't know, whose plight shouldn't affect me personally, and it doesn't impact my life, but it also does. Knowing about these people, knowing that people are suffering without health care, that makes me upset. Bernie Sanders put it perfectly. He was talking, this is in context to his beliefs, but he said this: when others suffer, it affects me. That's my spirituality. I mean, nothing really encapsulates the phrase "not me, us" better than that. I hope we do get to a place where we all fight for each other, for fellow Americans as well. And That said, this is really good news for the 200,000 people who will ultimately benefit from this. And not to mention anybody who loses their job as a result of, for example, the pandemic. Now, 40 million people unemployed, losing their employer sponsored insurance. I'm sure there are hundreds or tens of thousands of those people that are in Oklahoma that are losing their jobs as a result of this. And at least now they can continue to have some form of health care until they get themselves, back on their feet. And that's a good thing. At the end of the day, it's the right thing to do. I'm very, very proud for of Oklahoma voters for doing it. Hey guys, hopefully you enjoyed that free video. Now I'm gonna have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know how I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.